Workplace risk elements include presence of hazards, probability of exposure, probability of risks, false answer, probability of harmful effect, probability of vulnerability. Biological properties of disease agent are: true answer, infectivity, pathogenicity, virulence, false answer, toxicity, otaresis. Methods of economic evolution are: true answer, cost utility analysis, cost consequence analysis, false answer, cost minimization analysis, cost efficiency analysis, opportunity cost analysis. Methods of economic evolution are: true answer, cost utility analysis, cost consequence analysis, false answer, cost minimization analysis, cost efficiency analysis, opportunity cost analysis. Economic evolution can take a number of forms: cost benefit analysis, cost effectiveness analysis, cost utility analysis, cost consequences analysis. Semi-variable cost includes: true answer, equipment cost, vehicle cost, false answer, building cost, drug cost, personnel cost. True answer, equipment cost, vehicle cost, false answer, building cost, drug cost, personnel cost. Semi-variable cost remain fixed up to a particular production volume. Beyond this volume, semi-variable cost increase in direction proportional to output. Wages, for instance, are semi-variable costs which multiply by 1.5 beyond 40 hours worked in a given week, also called time and a half. What is semi-variable cost? A semi-variable cost has characteristics of both fixed cost and variable cost. Once a specific level of output is surpassed, Organizational budget may be capital budget, revised budget, surplus budget, false answer recurrent budget, deficit budget. Recurrent cost includes, true answer, equipment cost, vehicle cost, travel cost. False answer building cost, drug cost. Negative externality in healthcare are, negative externality in healthcare are, true answer, climate change, disease screening, passive smoking. False answer herd immunity, gardening. Capital cost include, true answer cost of equipment, false answer cost of vehicle, cost of drug, cost of repair, cost of travel. Direct medical cost comprises consultation fee, drug cost, bed charge. False answer travel cost, attendance cost. Demerits of health insurance include, all answers are false, moral hazard, adverse selection, co-insurance, deductible, risk pooling. Methods of economic evaluation in public health include, true answer cost benefit analysis, cost utility analysis, cost reduction analysis, cost effectiveness analysis. False answer cost efficiency analysis. Method of economic evaluation: cost minimization, cost effectiveness, cost benefit, cost utility analysis. Hospital utility services include, true answer blood bank, medical record, laundry and linen, housekeeping. False answer nuclear medicine. Hospital services: administration services, personnel management, financial management, housekeeping, material management. Utility services: dietary service, transport, medical store, public relation, security. Capital cost in a health program include, true answer cost of ambulance, logistic cost, equipment cost. False answer personnel cost, electricity cost. Data needed for daily calculation are, true answer wage, weight, time preference, patient preference. False answer constant budget. Approaches to healthcare financing management are, true answer setting targets to achieve goals. False answer balance between needs and resources. Use limited partnership, ensure maximum productivity, improvement of occupational process. Appropriate to financing of healthcare includes balance between needs, resources and use, appropriate selection of target. False answer productivity, occasional process of improvement, limited partnership. Emerging and re-emerging diseases. Re-emerging diseases occur due to drug resistance, genetic mutation of agent. False answer. Increased virulence of agent, decreased immunity, lower body immunity. Factor responsible for emergence and re-emergence of infectious disease are unplanned and underplanned urbanization, overcrowding and rapid population growth, poor sanitation, inadequate public health infrastructure, resistance to antibiotics, increased exposure of humans to disease vectors and reservoirs of infection in nature, rapid and intense international travel. Re-emerging infectious diseases are answer tuberculosis, false answer dengue fever, chikungunya fever, Nipah virus disease, H. pylori infection. Re-emerging infectious diseases include true answer tuberculosis, malaria, false answer dengue fever, AIDS, Nipah virus infection. গুরুত্বপূর্ণ ইমার্জিং রোগ এইডস, ইবোলা, মার্স ভাইরাস, সার্স, এভিয়ান ইনফ্লুয়েঞ্জা, বার্ড ফ্লু, চিকুনগুনিয়া, নিপা ভাইরাস ইনফেকশন, মারবার্গ। রিইমার্জিং রোগ পুনরায় দেখা দেওয়ার কারণ মিউটেশন, জীবাণুর আক্রমণ ক্ষমতার তীব্রতা, ভাইরুলেন্স বৃদ্ধি পাওয়া, চিকিৎসার বিরুদ্ধে রেজিস্ট্যান্স, ড্রাগ রেজিস্ট্যান্স, নতুন কোনো বাহককে আক্রমণের ক্ষমতা প্রাপ্ত হওয়া, কোনো ভিন্ন জীবাণুর আবির্ভাব, জলবায়ুর পরিবর্তন। গুরুত্বপূর্ণ রিইমার্জিং রোগ পোলিও, ফাইলেরিয়া, কালাজ্বর, ম্যালেরিয়া, এন্টেরিক ফিভার, টাইফয়েড ও প্যারাটাইফয়েড, প্লেগ, ভাইরাল হেপাটাইটিস, অ্যানথ্রাক্স। রিইমার্জিং ডিজিজেস ইনক্লুড ট্রু অ্যান্সার হেপাটাইটিস বি, কলেরা, হিউম্যান প্লেগ, ফলস অ্যান্সার ডিপথেরিয়া, ডেঙ্গু। Following are the emerging diseases. True answer Nipah, chikungunya. False answer cholera, typhoid fever, anthrax. Examples of emerging communicable diseases are true answer bird flu. False answer anthrax, swine flu, hepatitis B, malaria. Pillars of hospital infection control are true answer decontamination of items and equipments, prudent use of antibiotics, hand washing. False answer isolation of doctors and nurses, decontamination of house. Pillars of hospital infection control: isolation and barrier precaution, decontamination of equipment, prudent use of antibiotics, hand washing, decontamination of environment. Nosocomial infection are transmitted by true answer direct contact, airborne, droplet infection. False answer, mechanical fomite burn. Route of spread of hospital acquired infection, direct contact, droplet infection, airborne particle, release of hospital dust into the air through the various hospital procedure, catheterization, intravenous procedure, infected catgut, dressing, sputum cup, bedpan, urinals. Spores can be killed by ethylene oxide, formaldehyde, glutaraldehyde, hydrogen peroxide. 3P, peracetic acid, ophthalmic acid, plasma sterilization, autoclave, hot air oven, filtration, cellulose membrane filter, ionizing radiation, gamma ray. Spores can be killed by, true answer, autoclaving, ethylene oxide gas, formaldehyde fumigation. False answer, pasteurization, water bath. Hospital acquired infection are, true answer, hospital cross infection, nosocomial infection. False answer, opportunistic infection, waterborne infection, contagious disease. Common hospital acquired infection, urinary tract infection, wound infection, burn, post-operative diabetic foot, respiratory infection, ventilator associated aspiration in comatose patient, gastrointestinal infection, food poisoning, transmission from infection staff or patients. Urinary tract infection, catheterization related, wound infection, burn, post-operative diabetic foot, respiratory infection, ventilator associated aspiration in comatose patient, gastrointestinal infection, food poisoning, transmission from infection staff or patients. The nosocomial infections are, true answer, infection acquired in hospital, cross infection in hospital. False answer, iatrogenic infection, certain types of nasal infection, infection resulting in nasal discharge. Types of nosocomial infection: surgical site infection, urinary infection, respiratory infection, vascular catheter infection, septicemia. Hospital acquired infections are, true answer, cross transmission nosocomial infection. False answer, waterborne diseases, contagious diseases, opportunistic infection. Components of SDG include, true answer, planet, people, prosperity. False answer, equity, universality. Sustainable development: planet, people, prosperity, peace, partnership. Sustainable Development Goals: no poverty, zero hunger, good health and well-being, quality education, gender equality, clean water and sanitation, affordable and clean energy, decent work and economic growth, industry, innovation and infrastructure, reduced inequality, sustainable cities and communities, responsible consumption and production, climate action, life below water, life on land, peace and justice, strong institutions, partnerships to achieve the goal. Components of quality assurance are QA strategy, reviewing, QA strategy, reviewing, QA policy, QA plan, false answer, achieving, archiving. Components of quality insurance components of quality assurance are QA strategy, reviewing, QA policy, QA plan, false answer, archiving. Components of quality assurance: strategic level, long term decision, quality policy; tactic level, medium term decision, training, facilities, operation of QA; operational level, day to day operation, SOPs, worksheet. Quality assurance activities include on-site evaluation, RANL testing, and random blinded rechecking. Indicators of Vision 2020 बाद. Elements of quality assurance are QA strategy, QA policy, QA plan. False answer, recorder, archiving. Sustainable development goal is, true answer, a set of 17 goals for future world. Negotiated at the UN. Agree on 25 September 2015. False answer, backed by a set of 179 detailed targets, backed by 379 specific indicators. Functions of community clinics include, true answer, EPI services, treatment of minor ailments, health education. EPI services, treatment of minor ailments, health education. False answer, treatment of diabetes, rehabilitative care. Skilled birth attendants include, true answer, midwife, doctor, nurse, medical assistant. False answer, medical technologist. Details. A birth attendant, also known as skilled birth attendant SBA, is a midwife, physician, obstetrician, nurse, or other health care professional who provides basic and emergency health care services to women and their newborns during pregnancy, childbirth, and the postpartum period. Objectives of national health policy comprises of universal health coverage and accessibility, appropriate use of technology. False answer, minimum utilization of human resource, gender inequity, improvement of educational level. Objectives of healthcare delivery system in Bangladesh are: ensure healthcare delivery at all levels, reduction of disease morbidity and mortality, reduction of severe malnutrition. False answer, reduction of infertility, reduction of healthy lifestyle. National Health Program for Children in Bangladesh includes, true answer, Deworming Program, EPI. False answer. HIV AIDS control program, TB control program, malaria control program. In Bangladesh, MMR has reached MMR has declined by 40% in the last decade. MDG4 target will be achieved in due time. Use of skilled birth attendants for delivery is impressive. Use of skilled birth attendants for delivery is impressive. False answer. Maternal deaths occur more in antenatal than postnatal period. Drowning is now responsible for 43% of all deaths between ages 1 and 5. HPNSDP Health, Population, Nutrition Sector Development Program. True answer is the third sector program of the government of Bangladesh is being implemented through 32 operational plans. False answer. Will end in 2017. Targets to increase TB case detection rate from 72% to 75%. Does not target to reduce prevalence of shunting among children. Indicators of MDG4 are as follows. True answer. Under 5 mortality rate. False answer. Proportion of 1-year-old children immunized against EPI diseases. Neonatal mortality rate. Infant mortality rate. Proportion of 1-year-old children immunized against measles. Millennium Development Goal include. True answer. 8 goals, 18 targets. False answer. 8 goals, 18 indicators. 8 goals, 48 indicators. 8 goals, 48 targets. 8 goals, 8 targets. New challenge in health promotion in Bangladesh. Increased re-emerging diseases, increased non-communicable diseases. False answer. Increased financial crisis, increased substance abuse, high prevalence of chronic disease. Correction. New challenges in health promotion in Bangladesh. Increased re-emerging diseases, high prevalence of chronic disease, increased non-communicable disease. False answer. Increased financial crisis, increased substance abuse. HPNSDP denotes health, nutrition, development. Correct words to fill in the blanks are population, sector. HPNSDP denotes health, population, nutrition, sector development. Most vital indicators of MDG are maternal mortality ratio. False answer. Total fertility rate, infant mortality rate, adolescent pregnancy rate, contraceptive prevalence rate. Indicators of MDG4 are. True answer. Infant mortality rate proportion of 1-year-old children immunized against measles, child mortality rate, under 5 mortality rate. False answer, proportion of 1-year-old children immunized against EPI diseases. Following personnel provide services from community clinic. True answer, health assistant, community health care provider, family welfare assistant. False answer, medical assistant, family welfare visitor. Functions of district public health nurse are supervising nurses in Upazila health complex, teaching nursing student. False answer, planning activities in civil surgeon's office, conducting hospital audit, managing critical patients at outpatient department. Public health nurse, PHN, providing health care, preventive, promotive, curative, and rehabilitative to all individuals, families, and community in the respective field. Training, supervising, and guiding the health workers in the delivery of healthcare services to community. Planning, RCH, reproductive child health, including family planning programs with health workers. Follow up services in school health, family health, school health or family welfare programs, assisting in implementation of national health program. Health related MDGR. True answer, eradicated extreme poverty and hunger, reduce child mortality, improve maternal health. False answer, achieve universal primary education, promote gender equality. Disease control program in Bangladesh are true answer, Kala-Jar control program, malaria control program, tuberculosis control program. False answer, yellow fever control program, enteric fever control program. MDG have to answer 8 goals, 18 targets. 3 goals are directly related to health. 3 goals are directly health related. False answer, 50 indicators, no road map.